All right, welcome to Birthing the Gifts. I am clinical psychologist Dr. Kyla Holmes. Here at Birthing the Gifts, we provide safe and compassionate spaces to grow your gifts. In this interview series, we discuss the process of giving birth to your God-given gifts. Today, we have with us Dr. Keneshia Bryant-Moore. Thank you for joining us, Keneshia.
Well,
It's
thank
good
you
to
for
see you.
having me.
Yeah, absolutely. You're helping me launch this series in 2023. So I definitely appreciate it. Man, for folks that's watching us, Keneshia, I feel like Keneshia, I heard your name first back in, when was that? Probably I moved back to Arkansas in 2009 when I joined there at our local university. And I started hearing your name, I think, right when my feet touched down and I got involved in professional organizations and everything. I said, I'm gonna have to meet this Keneshia, doing all of this work in the community and everything. So the more and more I heard about you, I said, this is somebody that is gifted, that clearly God has given her gifts that she is intentionally on purpose using to help people and to raise awareness. So I know, let's just kind of jump in because my understanding is that you started in nursing, right? Because when I met you, you
Mhm.
were in public health, the public health arena, and you're still in the public health arena, but you
That's right.
started in nursing. Is that right?
That's right. So
Yeah.
I worked my very first job actually as a registered nurse was in North Carolina, at the University of North Carolina, Chapel Hill. And I was an RN for a year before I went back to school to become a family nurse practitioner. And I practiced as a nurse for 10 years before I worked in the academic setting. And I was actually at UMS. And it's funny because I started in UMS in 2009. But
Oh,
I
okay.
moved from Southern California to Arkansas and I just hit the ground running when I got here and
Mhm.
haven't stopped.
And haven't stopped. And that's the thing, right? I think that's what's important for people to know that. I mean, we may have some times that slow us down, but we know that this it's a process series is to talk about the process. So that's what I'm hearing you say, that you never stopped. I think that's one thing I know about you is you hit the ground running, you have a vision, you have a goal, and you keep going. You keep going. And so that's what
Mhm.
we want to talk about with the process is really how to keep going even when it gets hard. Because just because people keep going and hit the ground running, still going, don't mean it wasn't some challenging times, right? And
Oh,
doesn't mean
definitely.
that it's difficult. But if you can maybe start us, like, how did you even get into nursing from the beginning? Like, when did you know at any point in your life that, hey,
Mhm.
nursing is what I want to do? And like, what was it about? Yeah, just tell us about that part.
When people said that God has put like a purpose on their life, I knew from I was probably 7 or 8 that I was going to be a nurse.
Mm,
And my mother was a teacher, and so I also said I want to be a teacher like my mother. So I wanted to be a nurse, but I also wanted to teach.
mm,
And I first, I couldn't wait. I was so excited to just even be able to engage in nursing. And so back, when I was young, I'm not going to say how many years ago, but the Red Cross used to have the Candy Striper program.
okay.
And my mother's mother, she was actually born in 1899 and she had a long, fruitful life. But she, at her end of her days, she had Alzheimer's.
Okay.
And though she stayed with us for a while, eventually my mother had to place her into a nursing home. And so, as a candy striper, I volunteered at the same nursing home my grandmother was at so I could spend time with her as well.
Mm,
And so, when I graduated high school, I was like, okay, I got a scholarship, went off to school, and I'm going to be a nurse. And when we talk about the challenges that we face in life, I faced my first greatest challenge when I was diagnosed with depression when
mm,
I was in my sophomore year. And
mm,
at the time, I didn't know what it was, and I didn't know what I was going through. And my grades suffered because of that.
mm.
And I had a counselor at the university tell me I was never going to be a nurse and I wasn't smart enough. And it had nothing to do about my intellect, my abilities. It was strictly that I had a medical condition that needed to be addressed.
Wow.
So once I
And
did
this was a professional that told a counselor that was in
at
a
the school,
professional
yes, an
role at the
advisor,
school who told that.
yes,
Wow. Okay. Wow.
yes,
That is
not
definitely when people trying to birth their pride. It's like everybody has that point where somebody tries to discourage them for what God put in them. Okay, go ahead. What yeah.
so I ended up leaving that university and I moved back home
Okay.
and I enrolled at University of Michigan Flint. And again, my transcript, unfortunately, when I was ill, had come with me. And during that same time, I ended up having what they thought was a seizure.
Okay.
And I was on medication that I ended up being allergic to. I was very sick for a while, couldn't drive or anything. So my mother was
Mm,
taking me back to school. And so I have faced all those medical challenges. And it was time for me to apply for the nursing program after I had done my prerequisites. And I was not admitted, not
mm.
once, not twice, but 3 times.
Wow.
And this is each semester that had gone by. And I, at that point, was feeling defeated. And I knew that God had intended me to be a nurse, but it looked like that pathway was not going to happen.
Mm,
My parents knew that I've been saying this for like my entire life, I'm going to be a nurse. And just fortunate for us at the time, the chancellor was from Arkansas.
mm,
And he was going to our church there in Michigan. And my parents made a connection with him because one of my aunties actually taught him in school.
huh,
And through that personal connection, he actually sat and listened to my story.
mm,
And he was just like, oh, all these medical things that you faced, that's why your grades were suffering at that time.
mm,
So the fourth time I applied to get into that nursing program, I was finally admitted.
mhm,
And I told my parents, I said, I've been in this school forever. I'm going to come out with 2 degrees.
mhm.
So I said, not only did I graduate with my undergraduate in nursing, I also had a undergraduate degree in healthcare administration as well.
Wow.
And for all the people that said I couldn't do it, I said, God
Mm.
is going to make it happen. And he did.
Wow. And he did. I loved it. I love you said God is gonna make it happen. And he did. Wow. And that's something it said you went, it was several moments of
Mhm,
just I wouldn't even want to put language to you for, but extreme
mhm,
challenge. Went back home. Your parents sound like were a definite, significant support. And
mhm.
and you kept being persistent. You kept being
That's right.
persistent, kept applying. But I like what you said when you met with the gentleman. You said he listened to my story.
Mhm.
Do you mind, like, let's sit there for a minute if we could. What was it like to have somebody, I think, in that position, especially, right? Like who had a level of influence, and he listened to your story. What was that like for you?
It felt like the first time that someone was looking at me as a person rather than my application, and someone
Mm,
who was actually concerned and compassionate about me, Keneshia, rather than just some number, some student, some insignificant person. And he never questioned my ability,
mm,
never questioned it. Now, I will say it was people once I was in the program that did question it, and I had to overcome those barriers as well.
mhm.
But you know, I was finally given that opportunity that I had been denied just because he was willing to take that meeting to sit, listen, and then not only listen but put some action behind it, to ensure that my application was actually reviewed in consideration of my health conditions that I had been facing.
Wow, wow. So it sounds like that was key. Definitely God's hand working and just continuing to make it happen for you. So you can birth
That's
again. You
right.
knew from 7 or 8 years old. 7 or 8
Mhm.
years old, you knew. So you said even as you moved through, you went through the program, you still had to overcome more challenges. How would you say you did that? What helped you in your process as you were clearly birthing a gift that you knew
Hmm.
was in you from young? How did you keep overcoming the challenges even as you were in the program?
And I contributed that totally to the National Black Nurses Association.
Mhm.
They had a local chapter, the Greater Flint Black Nurses Association, that basically took us. It was not just me, but some other African American students as well under their wing. And my
Mhm.
mentor from way back then, it's still, I still keep in contact with her.
Wow.
And I can't stress enough, the importance of that mentorship and having a sense of community and
Mhm.
knowing that I'm not struggling alone. Or,
Mhm.
if I'm successful, is somebody there cheering for me and excited about my accomplishments as well.
Mhm. Wow, wow. So that's the key. That's interesting. That's one of the things that came to your mind: mentorship and community. So you feel like that
Hmm.
really helped you to keep going, even as it had some challenges there in the program. Okay.
Definitely, definitely.
Wow, wow. So let me know, how did you end up? So you were in nursing, and how did you end up going to public health? I know we're probably jumping over probably quite a bit. We might have to have a part two, Keneshia. But like, what was that like to go from nursing to public health, and what made you make that transition?
So, being engaged in the community, I've been doing that since I can remember as well. So, I would say when I was in undergraduate, my undergraduate program, I worked as a community health worker under AmeriCorps. So I was doing HIV education testing within the community, doing community outreach. When even as a nurse practitioner, I worked in and managed a clinic that was on a school's campus. So just being there in the heart of the community is always where I knew I was supposed to be.
Mhm.
But I think the difference came is when I was pursuing my doctorate degree, I was still, seeing patients as a nurse practitioner. And I felt like I was still just making impact on one patient at a time and
Mhm.
limited to how many patients I could see in a day.
Mhm.
And I was realizing that some of the health needs, I could not address them in the clinic. They were
Uh,
community level needs. And
okay.
even though I feel like, me being in a clinic setting was important, I felt like it was more important for me to reach a greater number of people
Mhm.
rather than just one patient at a time. And so
Mhm.
my research kind of transitioned me to, from a clinic setting to more of the community setting so I could have that greater impact. And I attempted to do both for a while to still continue to see patients and to do my research.
I
But
understand.
overall, the research and the community engagement and programming became so large that I have not practiced in probably last 6, 7 years now.
Okay, so you had to shift it, but I love what you said. It sounded like from the clinic to the community. I love it,
That's
from the
right.
clinic to the community. So I think we might have to rewind a little bit, because I know we kind of transitioned to the community, but you said something that I think was very important. It talks about you birthing your gifts and just all along the way. So it seemed like you went from your bachelor's, but I'm hearing you say that you got your PhD in nursing, right? In nursing.
That's correct.
So let's maybe rewind a little bit. We may come back to the community, because I think that's when I met you, is when you were on your community journey. So that's when I started
Hmm.
to learn more about you. But what made you? Because I don't know that I hear about that all the time, right? Like, I know it's wonderful, wonderful, much needed to have nurses in the capacity that they're in and that they flow in. But what made you decide? I want to go the PhD route. I want to keep going with this thing.
And so it's so funny because I thought when I completed my master's degree that that was going to be it. I was going to be a family nurse practitioner, stay in the clinic setting, and that was it. Until I was in the clinic setting, I would say probably a year or two.
Okay.
And I realized the number of men, especially that were coming to the clinic. And again, it was a clinic for uninsured or underinsured adults.
Mhm.
And I was in Southern California, and the resources were just not available for me to refer patients experiencing mental health issues.
Mhm.
And, as a primary care provider, we're supposed to be the gatekeeper to connecting, our patients to services within the community.
Mhm.
And first, I had received some, but very limited training on managing depression and anxiety and other common mental health disorders, which in some cases we're expected to manage. But
Mhm.
unfortunately, when we're working with patients who are uninsured or underinsured, the referral process was painfully slow.
Wow.
And so I was in the position that I kept pursuing more education, more training around common mental health issues, because I would put in a referral and it would take 6 months to even get an appointment. And that's
Wow.
assuming that my patients felt comfortable enough to even go to that appointment, because it wasn't within the clinic that they were so accustomed to coming to and felt comfortable with.
Right.
And so I felt like I was doing pseudo mental health treatment, which was not a position any provider wants to be in.
Mhm.
So I was, checking on patients, having them come to the clinic weekly to make sure that they were stable while I started them on their medications and what have you. And I was just like, this is not the type of healthcare I want to provide,
Mhm.
nor do my patients deserve. They deserve better than this. And
Okay.
so I went back to school to try to figure out, research to how do we better connect. And of course, I was still thinking very much clinical. How do we connect primary care patients to mental health services? And that's where my
Oh,
mind frame was.
wow.
Um,
Wow. And you wanted to, because so it sounded like it went from, if we could just like look at that, because it sounded like it was in your mind, you were thinking about it your day to day. Because sometimes I'm pausing right here, Keneshia, because sometimes I feel like people sometimes don't realize that they really do have a purpose and a calling and a gifting and assignment in them, that something is in them that got their attention. Right. Because I noticed that
mhm,
sometimes it can be a lot of people probably operating in the space that you were operating in that may not have noticed that may not have picked up on that, and may not have been, or even if they did realize, man, people aren't being connected from their primary care to mental health, like they may have seen it, but it may not have created enough uneasiness in them to say, now I'm going to do something about it. Right. So
right.
that's different. I think I've noticed that about you over the years. You notice a thing, and then you're like, I'm not just going to notice it and then have a vision about it. I'm going to translate that into action and do something and see what can be my part. Right. So that's
That's
just
right.
what I'm listening for, that caught your attention. So people will know like that may be connected with something that you're supposed to do because it
Mhm,
caught your attention. And then
right.
it sounded like it continued, not just one day. It kept staying what on your mind, on your heart, on your spirit. Okay.
That's right. And I must say too, I am very hypersensitive to that because of my own experiences with depression and anxiety. And so if I see a patient suffering or having these experiences and they're like, I don't know what to do, because I can relate to them, I think that is just probably made me even more like sensitive to the issue and like, no, we need to do something about that. Because my
Mm.
own experience seeking help through my primary care provider was not it could have been better. It
Okay.
was not the best. And I realized back then I was not, at the age of 19, I was not offered any medication. I was sent to therapy. And then, when I became a nurse, I'm just like, why didn't they give me medication so we can actually move
Mhm.
this process on a little bit quicker? Because I'm like, I'm
Yeah,
going
so
to
you
get
need
through
a
this
little bit of both. That
episode.
combination approach can work. That
Yeah,
combination. Let's do therapy and medication. Yeah, yeah.
medication, not just
But that,
therapy.
yeah.
But so I think I'm very much hypersensitive to that. And even
Mm.
prior to then, when I was in high school, a friend of mine attempted suicide.
Mm.
And I was the first person she called. And she lived right around the corner from me, and she called, this is back when we had house phones. And, being 16, I'm like, I didn't know what to do. And so I told my parents, I was just like, she just called, this is what's going on. My parents told me to stay out of it. Don't get involved. But in my heart, I'm like, that's not right. Mm-hmm. She's reaching out to me. I'm the first person she called. I need to go do something. So again, being naive, I'm being the 16-year-old. I call another 16-year-old, like, what should we do? And we met at her house, and we ended up calling 911, and they ended up, taking her to the hospital, and she was fine and was able to receive proper services. But then, like, thinking about my own personal experiences, seeing what my patients were going through, I think all of that was like a trifecta. Like, no, we need to do something. There has to be more education in the community. There needs to be more access to mental health treatment that I don't consider subpar, because what I felt like I was given was not obviously optimal care. Mm-hmm. And we need to do something about it. Okay. Or I need to do something.
I like you said, all of it need to do something about it. Like, I think that's the thing. I hope people really catch that, when that comes up in them, where it's just like I need to do something about it type of moment. That means pay attention to that. Pay attention to that. I need to do something about it. So you did. Mm-hmm. You got your PhD. You got your PhD, and then you were in the College of Nursing for a while, right? And then you realized, from the clinic to the community. And then is that kind of when that transition, and then you kind of made a home, and then the College of Public Health, where that gave you more of that opportunity and that space with the community? Was that?
Yes. And so it was multiple things. Okay. Because obviously we have community health nursing. Okay. But some colleges and of nursing are a little bit more, I guess, focused on the community than others. And where I was, working at, they were less community focused and more clinic focused. And so they couldn't understand why I wasn't in my office. So they're like, I'm like, don't look for me. I was like, I'm out in the community. I'm with the people. So transitioning to public health, not only did they realize, no, you need to be out in the community. How else are we going to build trust in these relationships and these collaborations? But also there were other folks who were actually interested in engaging the faith community, which, always was in my heart. And honestly, I pursued my doctoral degree at Azusa Pacific University, which is a faith-based university in Southern California. And I intentionally went there because they integrated the intersection of faith and health into my degree program. Nice. And so understanding, faith traditions and how they view health, how they, develop programming and hospitals and whatever related to that, I was able to integrate that into my education. And the funny thing, but I said this is a God thing, it's not a funny thing, is I had not intended to integrate that into my work as far as a researcher. I was doing that for my own personal growth. But when I moved to Arkansas and I knew that I wanted to engage the community, the very first community I went to was up in Mississippi County. I was in Blytheville, and I met with someone, and we were talking about the community's assets. And, we want to draw on the assets of the community when we're talking about addressing whatever concerns we have. And he was just like, look around, there's a church on every other corner. And I was like, you're right. This was right up my alley. And then he ended up connecting me to some of the local pastors, some of which now I've been working with over 10 years. Wow. And so it was, and so I would say it wasn't a funny thing. It was a God thing, because it was in that plan all along, and I was not even aware of it.
Wow, I love that. It wasn't in the plan. And I wonder if all along, because you remember the conversation started at 7 or 8. So it's
That's
like
right.
really all along, really all along that, yeah, that it was the plan and it just continued to just unfold as you moved along your journey. But it was
Mm-hmm.
right there. It was right there. And then it's like you noticed it, you were able to connect with somebody who highlighted, you were like, yeah, right up your alley. And it's all
That's
connected.
right.
It's interesting how everything is just connecting all of where you were on your journey. And then it's all connecting. And then you found yourself in that moment and realized
That's,
that it's an asset on every corner.
that's right.
It's an asset on every corner. Okay. And then now I know it's so how was that connected to the faith network? If we can talk about
Mhm.
that. I don't know if that's when it started to really manifest and then get close to that birthing is the faith network. But talk to us about that.
Yes, definitely. That was probably a few months that after I had moved to Arkansas, I was connected to the community up in Northeast Arkansas, and I then started like connecting with other researchers at the university that were already conducting um, collaborative research with the faith community in the Delta. And I started doing work, started partnering with them, and I literally had a dream of the Faith Network. And I went to work the next day, and I was like, I told my colleague, Dr. Tiffany Haynes, I was just like, I had this dream. There's a funding opportunity. I'm going to submit this letter of intent, and just to see if this what's going to happen. So it was like literally the next day it was like due. So I wrote up a quick letter of intent, submitted it, and I told her, I said, if they ask for the full proposal and are interested in funding us, I'm like, no, this is what God has intended me to do. And
Mhm.
sure enough, they requested a full proposal. We submitted that, received $250,000 grant to develop the Faith Network.
Wow. Look at
And
that.
that is really to build that collaboration between the university and the faith community in Arkansas to address health disparities, inequities, and particularly in within vulnerable populations. And so, over the years, I was in 2016, it started, and we have received over $1 million in funding since then.
Wow. That is amazing. Look at how it all just kind of comes together. And then you said you had a dream. God gave you a dream
Mm-hmm.
next day.
Yep.
So in the dream, I'm assuming it kind of came together. It's like this is the faith network that came together. God revealed it to you, and
Yeah.
then letter of intent.
I just had to put it on paper.
Just had to put it on paper. He downloaded it. I know people will say he downloaded it, put it on paper, and then here we go. And then it sounds like he funded it. He was like,
That's
okay,
right.
all I need you to do is put it on paper.
That's
Oh, I
right.
love it. I love it. And then you say, here we are years later. That was 2016.
Mm-hmm.
Okay. Wow, wow, wow. So, man, I'm pretty sure we could have a whole kind of dialogue about all of what you've done with the Faith Network because I feel like that's when I really started to connect with you and because I myself has an interest in that intersection between faith and mental health, spirituality, all of that. And so, man, it could be a whole conversation in and of
Oh,
itself. But I
you
think I
could.
want to get to your newest endeavor. So, how did that newest endeavor like come about? When did that get stirred up that you had that realization?
So my newest adventure is Mariposa's Place of Wellness, and I first I think it was when the pandemic hit, and being in public health, we were faced with, oh my gosh, we got to get people not only, well, first it was like we got to protect people from getting it, then we have to get people vaccinated and all these different things. And so I was heavily active far as work and doing work with COVID. But then in my own personal life, I have 4 girls, and in the midst of the pandemic, my youngest was in the first grade, and we all went virtual. And that did not go well.
Okay. Like,
So
whoa.
I
Or the youngest in first grade, virtual. Like,
yeah, so
okay.
a 6-year-old doing virtual school did not go well at all. So
Okay.
couple weeks in, her and I both are crying. And we're like, this is not working. We both stressed out. I ended up pulling her out of school for that school year, and I was her first grade teacher while I was working full time and still managing 3 other girls who all have ADHD and are in virtual school. So
Okay. Like, I'm
it
breathing
was
for
a
you.
lot.
It's like, breathe. Like, okay. Okay.
Yes. And so, and then having like an outlet for them, and then being concerned about their own mental health. It was to say it was a lot that's an understatement. It was a whole
Right.
lot.
Mm-hmm.
And I realized I burned out, and I was still trying to push myself. And it was actually my primary care physician was just like, you need to go sit down somewhere. And she was like, I'm putting you on medical leave. And I was like, no, I'm not going on leave. I need to do this. Like, the world's going to fall apart if I'm not working. And at that time, she was just like, no. And so we bargained, and I took off, I believe it was 6 weeks totally. I didn't work. And then I worked just part-time for another few months. And during that time, I was just like, I finally realized, no, she's right. Some of my family and friends were like, no, Keneshia, you're not Wonder Woman. Go sit down somewhere. And I intentionally sought out opportunities to make myself whole again. And during that process, I realized that all these years I've been fighting about health disparities and inequities. And I finally realized that I was a health disparity. I have a hypertension. I battle with my weight. I'm like all these things that I'm like been doing research on and educating the community on. I was not practicing good self-care. And I realized that I needed respite. I needed some restoration. And I looked around Arkansas, like, where can I go just for a retreat so I can actually have time with God, just me and him, just to get myself together. And looked around, and for a space that was diverse and welcoming of all people, that I could just go and find that respite, I couldn't find it. So I ended up going to retreats outside of the state, held by various people, doing various things from yoga, meditation. I was out hiking, you name it. I was out doing it for like most of last year. And during all that process, I realized that I had boundary issues with work. And because I am so passionate about so many things, I constantly go and go. And again, I felt like God spoke to me. It was just like, I know you're not gonna act right. So in order to get you to act right, what you've been seeking here in Arkansas, you can create that. You can create that space. You can create that retreat, that respite. And in the meantime, that's going to require you to engage in some of these things that have made you whole again. That is actually practicing that self-care. That is actually stopping, pausing, get that reset button so you can then move forward and do what I have intended for you to do.
Yeah, that's key,
And
Keneshia. I think we got to pause there for a second, because you said a couple of times about it sounds like you were on an intentional part of your life journey to say, I need to, on purpose, do some things, make a priority becoming whole again. And it sounded like that was critical for you to continue to do the things that God called you to do, to continue to birth your gifts, right? So that's so key. That's part of what I feel like with this birthing the gifts, like nonprofit and all of it, is that people, as whole as we can be, it's a process. That's why we had this conversation. It's a process to get whole. And sometimes you got to have a process, like you say, I got to get whole again. But like, that's still critical. It's a process. It's not about perfection. It's not about getting whole, staying whole, never having moments, never having bumps in the road. It sounds like it's not about that, but you did have to intentionally do it so that you can truly be the healthiest version of yourself to truly birth your gifts and continue to
That's
birth
right.
your gifts, really.
That's right.
Okay. All right.
Yeah.
And it sounds like then that's where I want to say it right, Mariposa. Am I saying it right?
Mariposa. Yeah.
Mariposa.
Yeah.
Okay.
And
That's where that
there
came
and
in. Mhm.
that's right. And people always ask me, like, where does the name come from? And so Mariposa is Spanish for butterfly.
Okay.
And I am in love with butterflies. And the name actually came, I do a little bit of belly dancing for stress relief. And we were coming up with stage names and for a performance. And I was like, I'm going to be Butterfly. And
Okay.
they told me Butterfly sounded like a stripper. And so it was not the it's like, I don't want to be out here with that name apparently.
Okay.
But a friend of mine said, no, Mariposa sounds a lot more, elegant.
Mm-hmm.
And so, and then she asked me, she was like, why, do you like butterflies so much? And I started to think first, like, oh, they're beautiful. And then I stopped to think, I was like, no, it's like that transformation process.
Mm-hmm.
And I feel like I am constantly being transformed in various
Mm.
aspects of my life. And so I just kind of call that transformational living because I'm constantly being transformed into a better version of myself. And so just thinking about that butterfly and the transformation process, that it goes through, that is what kind of brings Mariposa to life for me. And so the place of wellness is exactly what it is. I want people to be able to come and be transformed into a better version of themselves.
Wow. I love it. I love it. Transformational living. So it sounds
Mm-hmm.
like that's what Mariposa's place of wellness in some ways stands for, is like this transformational living. And like I said, we're constantly transforming. So we don't
Right.
think we've had one kind of part of that, one iteration or whatever of transformation. And then we have now been transformed and we have arrived at our just ultimate place of being evolved, right? So you're saying
That's
this is
right.
a constant process. This is a constant
Mm-hmm.
process. All right. Tell us a little bit about what you're doing as you're launching Mariposa's Place of Wellness. What are you doing? What's on the horizon?
Yeah, so right now we have purchased our property. It is near Hot Springs Village in Arkansas. And it is we have a building we're renovating that I refer to that as the cocoon. And so the cocoon is a 2-level building. Upstairs we have a space for meditation and prayer. We have a space for a pretty large space actually for yoga or dance room, and also for massages. And downstairs we have a gift shop, a kitchen, a dining area, and actually a restroom that includes showers, and we have a washer and dryer that's going to be in there. Because our
Wow.
ultimate goal is to actually have a space for people to be able to camp and then have cabins down there as well. So that respite place, even if you just need a day or two to get away from it all, it's not that far from the city, but you drive out there on those 20 acres, you can still hike out there and just be at peace.
Mm-hmm.
And that's what we want. We want to have that space for people just to come and to be at peace and to get
Yeah.
restored and then go back out and in that process, of course, being transformed into a better version of themselves.
Wow. I love it. I love it. That is wonderful. That's wonderful. So it's a physical place where people can go, and will be the focus of what it is they're doing. It's like designed for that. So it sounds like you're breaking ground, you're developing this property, and
Mm-hmm.
with the sole intention of
That's right.
really promoting people, creating a safe space where people can come and work on this transformational living. I
That's
love
right.
it. I love it. Anything else? Any other things? I know you have also a series of events that you're doing now. Okay.
That's right. So in the meantime, while we're working on the property, we're doing monthly mini retreats. Right now, we're focusing on women's health. and we have a theme each month. So we have one on stress management coming up on. We also, I'm trying to think the next one. So we're developing vision boards, and we're talking about, envisioning the transformed you. What are you seeking? And I had the opportunity at a couple of events that I attended when I was on my wholeness journey, to do vision boards. And Mariposa's Place of Wellness was that vision. And things have moved. I swear God moves a little bit faster than than I want to sometimes. But this was literally a vision that I had March of last year initially. And I thought this was going to be something that a project I was going to work over in the next 5 years, slowly, purchasing the property, what have you. But God was moving a lot faster. So had the vision in March, develop a vision board and start, getting these ideas together. And by fall, already had the property and was renovating the space. So it's
Wow.
moving quickly.
Wow. So it just went, I'm telling you, it's something about putting that vision down on paper, right? It seems like that's another thing. It's like God downloads something into us. It's something about putting it on a vision board. I guess we say in paper, but I know sometimes people use electronic means now, but somehow putting it down on something you can look at is the point.
That's
Be
right.
able to see it somewhere. So you did that with it as a vision, and it sounds like that thing manifested. You say March 2022, by fall 2022, you had property.
That's right.
Wow. And then you've already started doing your mini retreats, your monthly
That's
mini
right.
retreats already. We're just here in January of 2023, and you've already launched that part as well. How can people find out about your mini retreats?
And so we do have a website. It's mariposasplaceofwellness.com. And we're also on Facebook and Instagram as well under the same name.
Okay, you may have to spell that out for us. Mariposas, help us out with.
Yeah,
Okay.
Mariposa is Mariposa.
Okay. Okay.
Just think
Okay.
about
So
the
they can
Spanish for butterfly.
Spanish for butterfly. So if they put that in there, people can find that on your website and also Facebook and Instagram to have to be a part of your mini retreats, what you're doing monthly. This is in person in Central Arkansas, right? Just so
That's
people
correct.
are aware. Okay,
Mm-hmm.
excellent, excellent. Keneshia, man, from the time that you were 7 or 8, God dropped it in your spirit, and now you're doing many retreats. You're working with the community. You broke ground on some property where people are going to engage in transformational living. I love it. I love it. So it seems like that's what's next. You're doing your mini retreats. You're going to have, it sounds like, more extended retreats as your space develops. That is wonderful. That's wonderful. Anything else you want to kind of leave the listening audience with? It's maybe folks out there who are struggling with birthing their gifts. They've tried to apply here, do this, do that, and they've received a lot of closed doors. What do you want to leave people with?
Just to stay encouraged. I think we have a tendency to look at people who at their achievements, and we don't always look at their struggles. And it's like we've all gone through struggles, but you have to stay encouraged and to surround yourself with people who are encouraging. And I think I've been very fortunate to have, people in my life who don't question, what God has told me, as they've been supportive. And say, not only, by words, but actually by their actions, and even financially, to say, no, we believe in your vision. We believe in what God has told you, and have been supportive. And so if you have that network of people around you, that is always awesome. And if you don't, then I say, find those people.
Yes.
Who are going to support you in birthing those gifts that you have. Because I do firmly believe that God has a purpose for all of us. And sometimes we listen, sometimes we don't. And sometimes we're just unsure, and we just have to step back and say, okay, is this what God is intending me to do or not? And it's just then listening and pausing sometimes and then moving forward on what he's told you.
Amen to that. Amen to that. I love it. Hopefully people are listening to all those nuggets that you're dropping, because that does help with the process. And hopefully people can stay encouraged and surround themselves with people, I love it, who can help them in that process to stay encouraged. Keneshia,
That's
if you
right.
could just say one more time, like your social media handle on Facebook and Instagram, how people can find you on social media.
Yes, again, it's Mariposa's Place of Wellness. And Mariposa is Mariposa. Just think of Spanish butterfly.
All right. Wonderful. Thank you so much, Keneshia. Love having you as a guest today. It's been another edition of Birthing the Gifts. It's a process conversation series. Thank you, everyone, for joining us today. Thank you again, Keneshia, for sharing with us your process.
Yeah, thank you.